Is South Africa ignoring the scourge of adolescents' pregnancy? In a country where gender-based violence is given such a high political profile, pregnancy of very young adolescent girls aged 10 and 14 is de facto evidence of statutory rape and should result in prosecution and conviction. It seems as if not much is being done. Samkele, tell us what exactly is happening.
Well, Mfundo, South Africa is witnessing a distressing surge in teenage pregnancies. It is more worrying that adolescents' pregnancy rates tended to be high in rural and mostly poor provinces such as Limpopo, Eastern Cape and Mpumalanga. This is an indictment against our society, our government and all leaders in general. Let's look at the stats, Mfundo, on what they specifically have to say about this adolescent teenage pregnancy that we are getting, particularly within the years of 2023, 2024. Over 122,000 adolescents gave birth between that particular period of 2023 and 2024, Mfundo. Then we had 2,716 girls aged between 10 to 14 that gave birth between the same year, financial year, between 2023 and 2024. Then we had 587,000 teens aged between 15 to 19 that gave birth between 2023 and 2024 within the same year. 90,000 girls aged between 10 to 19 were pregnant between 2021 and 2022. 150,000 girls were pregnant between 2022 and 2023. 150,000 girls were pregnant between that period, Mfundo. Then 33% drop out after becoming pregnant. That is the dropout rate within the high school sector of these particular girls that are falling pregnant within that particular category. Then 25% of the girls fall pregnant before the age of 20. That is according to the World Health Organization, Mfundo. And then let's just move forward to adolescent birth rates between these particular years. So adolescent birth rate between the 1st of April 2017 to 30 September 2021, adolescents aged between 10 and 14 increased from 2,726 to 4,053. That is a 48.7% increase of adolescents being pregnant between 10 and 14. Teenagers aged 15 to 19 increased from 329,000 to 267,000, which is an increase of about 17.4% of pregnancy between 15 and 19. Adolescent pregnancy increased from 951,000 to 292,000, which is an increase of 16.1%. Just look at those particularly staggering numbers, Mfundo. 951,000.
252.
252,000.
Quite
which is
worrying.
An increase of 16.1%, Mfundo. And that just tells you of this particular scourge of teenage and adolescent pregnancy that South Africa is particularly seeing an increase in these rural provinces of Limpopo, Mpumalanga, and other parts of the country that is increasing at a rapid rate.
And what have NGOs had to say about this? Are they satisfied with the interventions of government, though?
Let's speak to the NGOs and the specialists, particularly within this sector. Let's speak to Dr. Shahida, who is an expert within this particular sector, who does come from the Teddy Bear Clinic. Dr. Shahida, who's also a director there. Thank you for joining us on the SABC this evening. Dr. Shahida, just the essence of you as the experts on dealing with this particular matter. To what extent is adolescents' pregnancy viewed as a national crisis, and are parents and government and other stakeholders, what are they doing about this particular scourge?
So I just want to first say, let's make a strong distinction between teenagers and children. When we use the word adolescents, we are already euphemizing it. There's children, 10 years, 11, 12, they are children, birthing children. That is unjustifiable, it's unacceptable. And if we look at the extent and the scourge that we are currently faced with, that it has to be declared a national pandemic, like gender-based violence, child pregnancy and teen pregnancy needs to be addressed aggressively. What we are faced with on the ground, you identified the rural, the disadvantaged communities and in the different provinces. But even close to home, as we speak now in Gauteng province, we are continuously being approached by the academic institutions, schools particularly, who are reaching out on a daily basis. We had a school reaching out to us on this particular Monday. Over 20 girls in that school are pregnant, and they've just started high school. So one needs to realize that this is something that's not going to go away. And is government doing enough? I think government is only cottoning onto the idea now. We are working closely with Social Development, Department of Health, and of course, it's a collective effort. Intersectoral efforts need to be aligned and need to be implemented. Otherwise, we are not going to disrupt the cycle of child pregnancy.
Dr. Shahida, when you look at child pregnancy, it's a scourge that has particularly been going up on a number of years. Who is fathering these particular kids? Is it kids aged between 10 and 12 themselves, male and female, who are conceiving these particular kids at giving birth to kids as well? Or is it relatively elderly men who are taking advantage of young women and young girls, particularly aged between 10 and 12, being associated with young adolescent boys who are about 16, 17?
So it's a both-and answer. Yes, it is child on child, where we're finding teenagers engaging in sexual activity, but there are also adults who are engaging with younger children, with these teenagers and with your younger ones. And unfortunately, what we have found that some of the cases are not being reported and therefore not being prosecuted. Therefore, we are not seeing any convictions. And of course, this continues to perpetuate itself. Often in families, what happens is the adult will compensate the family, monetary or in any other shape or form, compensate the family. And families being in dire need will accept it. But what was interesting in this past 2 weeks, what we also, what we found out from parents are feeling so helpless. They're finding that teenagers are engaging in sexual activity, resulting in an unintended consequence of pregnancy. And then they say they don't know what to do with their children. So they just say, please leave the home, go and stay with your boyfriend. And they refuse to then acknowledge any kind of support or provide support to the children. So if we look at what is going on, I think it's actually a systemic problem, starting with children, families, communities, government departments, civil society. We all need to work together, because as we speak, we are working in silos. We're not working together. And as a result, we're finding that it's actually increasing the alarming proportions of children falling pregnant. And as you mentioned, the high attrition rate at school, but it's not only just the high attrition rate, but even the infant mortality and the prem babies and all sorts of other health challenges, including mental health, which is affecting many young girls as they remain in school, or even if they drop out of school, they have to face many challenges such as depression. We are also seeing suicides as a result of that. So this needs to be addressed immediately. If we do not do anything now, and when you say about government doing anything, I think they need to put funding towards this. As NGOs, we are applying to so many corporates, so many people out there to back this program to support the prevention of child pregnant learners, teenage pregnancies.
Dr. Shahida, in short, what are some of the immediate interventions you as the NGO sector have sought from government in order to stop this particular scourge? And does it have a bearing and the increase that may be seen within the infections of HIV and AIDS within the country?
Indeed, I think that's another huge concern, is around the increased incidence of the risk of HIV and, of course, full-blown AIDS, but even other infections. However, what support right now as we speak, I think we have engaged with government, with education, with social development, with health, to work together, because There needs to be coordination, collaboration, and integration of support services. Otherwise, we're not going to make any difference, and many children are going to continue to suffer and suffer from further trauma as a result of this.
Thank you very much, Dr. Shahid. We will definitely take this particular matter on, and we will be engaging with the government and the various sectors within the Department of Education, and also how the communities in themselves come to assist government on this particular issue. Mfundo, as you've heard, the experts are saying that it is a scourge, it is going up. Government is not doing enough in order to address this kids on kids, kids and kids, having kids between the ages of 10 and 12 and going on to teenage pregnancy as well. But then there is a scary issue of statutory rape that is also taking place.
Before we touch on statutory rape, I want to find out what happens when it is the kids on kids, where we're seeing these sexual encounters, consensual sexual encounters taking place between children. I know it's quite difficult for us to even say there would be consensual encounters between children because it speaks of a broader problem of early sexualization. But what happens in that instance when you've got two young ones that engage in sex in this instance?
Well, Mfundo, there, the challenge is the criminal law. Sexual Offences and Related Matters Amendment Act, which has some loopholes. And let's explore some of this particular issue, particularly when you look at the issues of statutory rape, criminal law, and Sexual Offences and Related Matters Amendment Act of 2007. The sex between adult and minors under the age of 16, that is particularly where you are having those particular minors between the ages of 16 and those who are 10 and 12 who are engaging in sexual intercourse. Then you've got children. A child under the age of 12 can't consent even with another minor, which brings to the point you were raising just now. So kids between who are 12 and 12, 10 and 12, there is no consent between those particular age groups within the country, and that you cannot have minors consenting to one another to engage within sexual intercourse. Then child over 12 consent with another child aged between 12 to 16. That is some of the matters that are there, particularly within this issue of the Amendment Act and Criminal Law of the Sexual Offences and Related Matters Act that is there within the South African Constitution. And then, Mfundo, then we go to the children between sections between 15 and 16, the criminal law, which basically states that the global teenage between 15 and 19 pregnancy within the year of 2015 to 2020, that globally, you looked at 41 births per 1,000. That is globally 41 births per 1,000 between the ages of 15 and 19. The Sub-Saharan Africa, you had 99 births per 1,000. That is Sub-Saharan Africa, 99 births per 1,000. Western Europe was 8 births per 1,000. Western Europe.
We're seeing a trend starting to form here.
1,000. Then you go to South Africa, our own country. 41 births per 1,000, Mfundo, and those are the stats that are basically there. Then it moves to matters, particularly when it comes to issues of adolescents. Pregnancy is not unique to South Africa, as the country's adolescents pregnancy rate of 41 per 1,000 is equal to this particular global average that is currently there. We move to the next graphic, which will speak about the factors influencing adolescent pregnancy. It is poverty and poor parenting. Poverty and poor parenting, and that looks precisely to the 3 rural provinces that we have in the country where you've seen this particular scourge growing. And then you've got poor access to contraceptives, which is a main issue, particularly within South Africa, where you've got also poor access to such issues as basics as sanitary towels. You've seen political formations, which is very progressive, if one may say, by the economic freedom fighters. In rallies, they provide in every seat that is there in a stadium, there will be water and sanitary towels. Doesn't matter whether it's a male sitting there or no male, but there will be sanitary towels for Samkelo if he attends the EFF rally to take to his younger sister at home and cousin who may not have the financial means to be able to buy those sanitary towels. You'd remember the Young Communist League at some point, led by Putima Namela, was saying that they must introduce a bill within the country and legislate it that government must provide free sanitary towels at schools, particularly for young girls.
With that poor access to contraceptives, there's also the phenomena of some nurses that would bully these young children. So it becomes very difficult for these young children, especially ones that are 10 or 11, to even go to a clinic and be assisted.
It also speaks to not only the bullying that is there, but also the lack of education that young men and particularly young women may be getting on sex or sexual intercourse at home. Many African parents, particularly within the African culture, are afraid to engage within this particular difficult conversation of sexual intercourse. I myself know a number of my friends, when you ask them, did you and your parents have the discussion about the deed? And they would say, we've never had such a discussion. I had to find out on my own, or I learned through conversations with my peers. And that is what you find very prevalent within our communities there in Mfundo. Then we would go and look at some of the global phenomena that are there taking place, which also influence these particular teenage pregnancies that we are seeing at a global stage in Mfundo. You will practically see that 13 million children, 66% of all children, earn a child grant within this particular club, which will cost about 85 billion rands for the 2024-2025 financial year. 7 million children remain below the poverty line. 7 million children still remain Mfundo below the poverty line. And these are influenced mainly because of poverty and poor parenting and the triple challenges that are there within the country: poverty, inequality, underdevelopment, and a lack of jobs in Mfundo, which is why we're explaining this particular scourge of adolescent and teenage pregnancy that many of these so-called young adults today are products where they were birthed by teenagers within the country.
And as we've heard from Dr. Omar, that we shouldn't euphemize this. We shouldn't be saying it's teenage pregnancy. This is children who are falling pregnant. And maybe perhaps it will hit home that if we say these are children, then it will start to be something that government does something about. Indeed,
government must be particularly paying particular attention to this particular scourge. It is a societal ill that is currently there. One wonders where the government is. Are they addressing this particular issue? But you also find that it's an issue that many leaders are afraid to particularly tackle in their communities. You've found instances in Mfundo where councillors are found to be sleeping with minors within their particular areas, and that just perpetuates this norm of an abnormal behavior within our society, because it is also largely perpetuated by local community leaders. It may be political, it may be traditional, and that will be further entrenched, particularly in our communities, and it cuts across the board: rural, township, urban.
Samkele, thank you very much for that. That's Samkele Maseko on Explain and Verify.